morning and welcome to our valued attendees. I am CJ from Healthway. We'd like to extend our warm welcome to our corporate accounts, Healthway and QualiMed patrons. We are live on QualiMed and Healthway's Facebook pages. Please share, like, and tag your family, friends, and colleagues. If you have any questions, please type them in this chat box and our guest speaker will answer them during the Q&A session. This lunchtime, we will provide you with the health information you need. Thank you for joining us for the fifth webinar in this Health Matters, the Healthway and QualiMed webinar series. Today's webinar topic is one of the most widely discussed and trending topics in the world. Sit back, relax, and learn everything there is to know about monkeypox outbreak. Let us introduce the speaker by calling on today's moderator, who will also join the guest speaker later in the Q&A session. Let us all welcome Dr. Monica Montecillo. Hi, Doc. Good afternoon.
Hi, good afternoon, everyone.
Yeah. Hello, Doc. Please introduce yourself first.
Hi, I'm Monica Montecillo. I'm an internal medicine and infectious diseases specialist practicing at QualiMed Santa Rosa. Okay, good afternoon, everyone. So we are privileged today to have with us the Assistant Secretary of the Philippine Society of Microbiology and Infectious Diseases. So our speaker for today is a graduated Doctor of Medicine from the University of the Philippines College of Medicine, and he took up his Bachelor of Science in Biology, major in Microbiology from the University of the Philippines, Los Baños. He had his internal medicine training at the Medical City, his Infectious Diseases Fellowship at the Research Institute for Tropical Medicine, and Arthur Ashe Fellow from the New York Presbyterian Hospital. He is a diplomate and fellow of the Philippine College of Physicians, of the Philippine Society for Microbiology and Infectious Diseases, and a member of Treat Asia, or Therapeutic Research Education and AIDS Training in Asia. Everyone, let us all welcome Dr. Mark Kristoffer Pasayan.
Thank you, Dr. Monica, for that introduction, and welcome to the Mark Pasayan Monica Montecillo talk show. Now, we promise everyone that we will give you a talk that will make you understand monkeypox even more. No, and I'd like to thank Dr. Monica Pia for giving me this idea on how we're going to deliver actually this lecture. So so welcome to the members of the QualiMed Health Network, and thank you for this invitation, for inviting us, me and Dr. Monica, to give you a quick backgrounder on what this monkeypox really is. Why should we be not worried about monkeypox, and what do you need to know about monkeypox? Dr. Monica, so will you start the ball rolling?
Yeah, so it's us again, no. We've had several webinars already. It's our partnership, no, Dr. Pasayan and I. So we'll again, no, let's just have an interactive session. So this will just be a breeze. So Dr. Mark, what is monkeypox, or why is it called monkeypox?
Okay, monkeypox is a viral infection. Bono. It's a viral infection. It's a zoonotic infection, meaning this is a virus that you get from animals. The natural host is still unknown, meaning hindi po natin alam kung ano talagang animal nanggaling ito. Pero this virus was actually first discovered in 1957 in Denmark in a research facility handling monkeys. And that's why it's called monkeypox, because it was first identified among primates, among monkeys. But dito sa nangyayaring transmission, we are looking at other animals as the possible vectors of this virus, and that includes yung rodents, rats and squirrels in Africa. Dr. Monica?
Okay, so how long has monkeypox been around, and what do you think caused this outbreak? Or is it an outbreak?
Like what I said, no, it was first discovered in 1957, but the first human case was actually identified in 1970. Hindi pa po ako buhay noon at mas alam hindi pa po buhay si Dr. Monica. It was in in Central Africa, in the Democratic Republic of the Congo, other previously known as Zaire. Now, during that time, the 1970s to the 1980s, several cases have been reported in Central Africa ng monkeypox. And actually, 59 cases were reported at that time. Not that high, not that big. But then again, remember, this is a new infection back then. And the mortality rate reported at that time was high at 17%. Now, why is there now this kind of outbreak? Why was there transmission from animals to humans during that time? Well, number one big factor that they're considering then was deforestation, disrupting the natural habitat of animals, and that actually caused the close interaction of animals to humans, particularly in that part of the world, in Africa. Civil unrest and poverty. We all know some political and social instability in those countries in Africa, as well as their social demographic status. Because of these conditions, people tend to look for other sources of food, and that includes wild animals. And again, that made humans in close contact with these animals. Also, climate change, the ever-changing scenario in the forest, and the different changes that's happening geographically, that also is a big factor. They say the stoppage, yung pagtigil ng smallpox vaccination in 1980 is also a factor. Smallpox and monkeypox are close relatives. So yung vaccination that people get for smallpox actually conveyed protection also against monkeypox. And dahil na tinigil ang vaccination ng smallpox in 1970 to 1980, because eradicated na nga ang smallpox, that actually made monkeypox infection very, very possible. And that also lessens the cessation of smallpox vaccination, also lessened the immunity of humans against monkeypox. Dr.
Okay.
Monica?
So you said, diba, that this was found in primates in 1957 and the first case was in 1970 in humans. But where is it commonly found? In which animal population?
It's commonly found in wild animals in the forests of Africa. No? So they identified several rodents, dormouse, yung squirrel, and pouch rat. So definitely hindi po ito nakikita sa ating mga bahay. Iba po yung ating mga bubuwit na nakikita sa bahay. At yung pang-apat na picture po dyan, hindi po yan ang picture ng kapitbahay ninyo. Yan po ang sooty mangabey. Isang monkey, isang unggoy na nakikita sa Africa. Nice fact also, the sooty mangabey is also one of those monkeys implicated sa HIV infection. So these are wild animals in Africa, and because of their close contact with humans in that part of the world, there was that transmission of this monkeypox virus to humans.
Okay, so you said these animals are usually found in Africa, no? So not in the Philippines, but how does it spread?
Well, ang spread ng monkeypox is because of the contact of humans with infected animals or infected animal products. Sabi ko nga, these animals were also used as food in Africa. So if an animal is sick with monkeypox virus and humans touch these animals or these animal products, there is that risk of infection. At yun yung tinatawag na primary infection. Now, there is what we call secondary infection. No, the transmission now happens from humans to humans. And it happens after close contact also, or exposure to body fluids, to skin lesions. That makes the infection possible to a susceptible person. There's also report of mother-to-child transmission, meaning isang babaeng nagbubuntis, kayang ipasa itong virus na ito dun sa kanyang dinadalang sanggol. And that causes the secondary infection among humans. And that's also the possible reason why we are seeing infection outside Africa. And several countries have reported non-endemic cases in their countries. And I will show you later the list of those countries because secondary infection or transmission is happening.
Okay, now that you're saying that we've been seeing infections already in several countries, of course, we'd like to know what are the things to watch out for. What are the symptoms? How long does it last? Do you make full recovery? Are we expecting that this will be as big as COVID?
Hopefully not. Hopefully not. And sawa na tayo sa surge, of course. But in terms of symptoms, ito kasi yung, I think, dapat na matandaan at maintindihan ng mga tao. Ano ba yung mga simptomas? Ano ba yung dapat nating bantayan? If you have monkeypox or if you have a probability of a monkeypox infection. So, ang monkeypox lasts for around 2 to 4 weeks or even longer. So, the whole syndrome, the whole duration ng infection would last for days to weeks, and it starts with incubation period. And the incubation period is from the time na kayo ay na-infect ng monkeypox until you become symptomatic. So it may last for 5 to 20 days, 21 days. Ganun po katagal. At during this time, wala kayong nararamdaman, wala kayong simptomas, at hindi kayo nakakahawa. Until dumating yung 1 to 4 days na kayo ay nilalagnat, kasabay ng ibang simptomas, tulad ng swollen lymph nodes or mga kulani, lalo na dito sa leeg, kulani sa leeg, sa likod ng leeg, at saka dito sa may mga sa tagiliran. Headache, chills, or panginginig, sore throat, malay, or masamang pakiramdam, or nangihina at fatigue. Dito sa punto na kayo ay naglalagnat for 1 to 4 days, ito din yung time na yung virus ay nakikita sa dugo. Ito yung tinatawag na viremia. Sometimes meron din nakikita mga tuldok-tuldok na puti sa loob ng bibig, katulad ng nangyayari sa ibang mga viral infection tulad ng tigdas. At ito ay maglalas ng 1 to 4 days. After this 1 to 4 days na paglalagnat, darating na, ito pala yung picture nung lymphadenopathy ng kulani. After ng 1 to 4 days, darating na yung rash stage. Ito ay maglalas naman ng 2 to 4 weeks. At yung rash ng monkeypox, kung titingnan, iba-iba yung stages ng rash ng monkeypox. So may macule. Yung macule po parang mapula na skin lesion lang na tuldok-tuldok na flat. Tapos magiging papule or parang mga maliliit na tigihawat na naka-raise or nakaumbok. And then darating na yung vesicle. Yung vesicle, yan yung parang bulutong tubig. Kung kayo nagkaroon na ng bulutong tubig, nakita nyo na ito ay malalaking umbok sa balat at may parang laman na tubig sa loob. At pagkatapos nun, ay magkakaroon ng pustule na imbis na tubig na nasa loob, parang mga nana or mga cloudy na material yung nandun sa loob ng umbok. Hanggang sa maging ito ay parang peklat or scab or parang nalapnos na balat. So ito yung mga stages ng pantal ng monkeypox. Ang particular sa monkeypox is makikita itong mga stages na ito sa taong may monkeypox na paisa-isa. Ibig sabihin for some time, puro macules lang. And then for another stage, puro papule lang. Ang susunod na stage, puro vesicle lang. Then susunod, pustule, and then scabbing. Hindi nyo ito makikita ng sabay-sabay sa isang tao. At yun yung isang particular na feature ng monkeypox. Sabi ko, yung monkeypox parang chickenpox, parang may tubig-tubig din. Pero maraming pagkakaiba ang rash ng monkeypox sa chickenpox at sa measles. Unang-una, magkakaiba pong viruses ito. Pero ang common lang dito sa tatlong ito, karaniwan, nauuna talaga ang paglalagnat or fever bago maglabasan yung mga rash. At kapag lumabas na yung rash, katulad nga ng sabi ko, sa monkeypox, dun sa 5 stages na yon, paisa-isa siyang nangyayari sa isang taong may gantong sakit. Pero kung chickenpox or measles, karaniwan nagsasabay-sabay. Kung kayo po ay nagkaroon ng chickenpox, makikita nyo na, ay bakit itong isa may tubig pa, yung isa naglalangib na or nagtutuyo na, o bakit meron na namang isa na parang pausbong ulit. So, noon yung nangyayari sa chickenpox. Sa rash development, mas mabilis ang chickenpox at measles. Sa monkeypox, mabagal. Kasi nga 2 to 4 weeks or even longer ang monkeypox. Kung nagkaroon din kayo ng chickenpox, nakikita nyo, ngayong araw na to isa lang, kinabukasan, buong katawan nyo na merong rash. Isa din sa difference ng monkeypox at chickenpox ay yung distribution. Mas common yung distribution sa face, sa mukha at saka sa extremities kapag monkeypox. At isa din sa mga senyales na baka monkeypox ito ay kapag meron involvement ang palad at saka yung talampakan. Samantalang pag chickenpox, it's more concentrated sa mukha at saka dito sa trunk area, sa dibdib, tiyan, or sa likod. Again, in-emphasize ko kanina, different ang monkeypox because of the presence ng lymphadenopathies or pamamaga ng kulane na hindi nakikita sa chickenpox or paminsan-minsan lang sa measles. At mas marami ang na-detect na namamatay dahil sa complication ng monkeypox kumpara sa chickenpox at measles. At ito yung quick difference ng monkeypox na sinasabi and chickenpox na sinasabi ko. Kapag monkeypox, it's more on the face and the extremities. Ito yung tinatawag na centrifugal distribution. Samantalang kapag chickenpox, it's more concentrated on the face and the trunk. Ito naman yung centripetal distribution. I think, and the last na part ng course ng monkeypox is yung tinatawag na recovery. And in recovery, there will be scarring. I think this is one of the notable complication of monkeypox is the scarring that these lesions will produce to those with monkeypox. And I know if some of you had chickenpox, nandun din yung pagkakaroon ng mga pockmarks or mga peklat dahil sa bulutong tubig. And that's the same thing that we see in monkeypox. And once all the scabs have fallen off, the person is no longer contagious.
Alright, so super tagal, no, as compared to the other illnesses.
Yes.
And the difficulty is that all those viral exanthems that you've mentioned all starts with rash. All starts with fever before the rash, no?
Mm-hmm.
So how do we diagnose monkeypox pa, Doc?
Okay, so how do we diagnose monkeypox? Well, we need to get a sample of that skin lesion. I'm sorry, hold on. Okay, we need to get a sample of that skin lesion, and yung roof nung lesion at saka yung base ng lesion ay isa sample. And of course, this is done by a trained professional, and it should be done with adequate donning of your personal protective equipment, because again, these lesions are the most infectious part ng isang person na merong monkeypox. And if we have cases in the Philippines, once this specimen were collected, it will be sent to 2 institutions. One is to Research Institute for Tropical Medicine in Alabang, and the other one is the Philippine Genome Center in UP. We are still developing and polishing the protocol for monkeypox diagnosis in the Philippines, and we're still waiting for the primers that will be used for the diagnosis of this monkeypox.
All right. So actually, we've had town hall meetings already, no, on monkeypox since last week, and we had a med tech who explained how to properly collect the specimen, how to transport them. So for those in the healthcare institutions, you can watch the DOH webinars so that you can have an in-depth discussion and to know how to proceed with collecting the specimens. Alright. So, syempre, ito yung most important question because we have nga COVID. So, parang grabe na yung scare ng mga tao. We had so many mortalities in COVID, especially during the Delta surge. Siguro, we would have mortalities almost every day, no? Sa dami ng pasyente, ang toxic ng patients. Tapos, ito, yung mga itsura pa ng mga lesions, parang this is something I don't want to have. Because I didn't have chicken pox. So, hopefully, hindi tayo magkaroon nito. But the most important question, I think the question of most of us is it deadly?
Is it deadly? Well, based on the reports, and this is from Africa, it's around 1 to 10%. It's still very high considering the very small yung mga cases, only 59% during that time. But the risk of dying from monkeypox will actually depend on several factors. One is ano bang klaseng monkeypox yung tumama sa iyo. There are two kinds of clades for monkeypox. One is the Congo Basin clade or yung nasa Central Africa na mas mataas yung mortality because mas grabe yung course ng illness versus sa West African clades or that's supposed clade which is 1% lang yung mortality. So it actually depends on which clade the virus that infected a person came from. Also, access to medical care. Again, nandoon yung civil unrest and poverty in that part of the world. So access to medical care might not be as good, and that actually contributed to a high fatality rate. Also, extent of exposure, how big yung inoculum or yung amount of virus that infected a person, again, depending on the extent of the exposure. And also, the health status. If you are immunocompromised, maraming ibang sakit, if you are pregnant or a child, then that actually increases the risk of dying from this disease.
Okay, so who is most at risk to get
Well,
infected?
if we follow the CDC report, the most at risk are actually those who are younger than 40, 50 years old. So I think I consider myself at risk because I am considering our age, Dr. Monica, di ba? At risk tayo. Siyempre lalo. Kasi bakit? Kasi natigil nga yung smallpox vaccination, no? Even before we were born. And a lot of our senior citizen population would have had a smallpox vaccine at that time. So there's that risk. So another reason for you to being at risk is if you are in close contact with infected animal or an infected person. But among those who are really being monitored right now would be children, pregnant women, and those people with a weak immune system, those with other illnesses like diabetes, hypertension, HIV, or even cancer, or those on chemotherapy.
All right. So there's already one question related to that, no, with regards to the MSM population, but we'll answer that later, no, Dr. Veloso. I saw a question already. Okay. So the next question is, have you seen anyone sorry. Yeah, have you ever seen anyone infected with monkeypox? Are there cases of monkeypox in the Philippines, no? Especially you're from RITM, Doc, so you might have some information.
I have not seen in my practice any case of any person with monkeypox. And I'm not looking forward to seeing one. But ayokong pang dumating doon sa most exciting part, which is having a monkeypox in the Philippines. But as of, this is a DOH advisory of May 20. There is an advisory show indicating that there is no reported monkeypox in the country yet. And to date, June 2, there are no reported confirmed case of monkeypox in the Philippines. But we have several suspected and probable cases, but still no confirmed case.
All right. So, should we be worried about having a monkeypox pandemic?
Um, if you look back to what I said, no, the monkeypox is an old disease. It's actually a re-emerging infection. It's actually present even before COVID-19. And when the Democratic Republic of the Congo reported more than 1,000 cases per year in 2016, kasabay actually siya ng Ebola. But then, hindi masyadong na-heightened or na-hype yung monkeypox. But why is WHO asking us to be on guard with regard to monkeypox? Because as of May 26, 2022, several member countries of WHO have reported cases of monkeypox. And to date, 257 confirmed cases and around 117 to 127 suspected cases have been reported in 23 countries around the world. And that's on top of the other cases, the cumulative cases that are being seen and still being seen in several countries in Africa. The one sa table sa left would be those countries na endemic or ibig sabihin common yung monkeypox dun sa countries na yon. And that's in these countries in Africa. The one on the right are the countries outside Africa where monkeypox are not or is not endemic. These are non-endemic countries. So imagine na lumabas or nakalabas ang monkeypox doon sa kanyang usual ground. And several cases are now being reported in these countries, and that makes it very alarming. That's why WHO is reporting this, and that's why WHO is advising all countries to put up their surveillance and case tracing to make sure that there will be no outbreak as big as, let's say, Ebola or SARS-CoV-1 or SARS-CoV-2 or COVID-19 that will happen in the future.
All right. Before we go to the next question, Doc, no, just to clarify, I think we haven't defined some terms. How do you differentiate a monkeypox suspect versus a confirmed case? Kasi on the previous
there is a case definition now published by WHO. A confirmed case is someone, or let's go to the suspect first. A suspect case would be someone who presented with fever, more than 38.5 degrees Celsius, with lymph nodes, with known epidemiologic link or exposure to an animal or to a person with monkeypox, and presenting with the typical skin lesions we see in monkeypox. And a confirmed case would be someone who has who was diagnosed through PCR with monkeypox.
Okay, thank you for that. So, how is it treated, and is there a vaccine for monkeypox?
Well, like any other viral infection, monkeypox is self-limiting. Kahit walang gamot, kusang gumagaling. Katulad din niya ng COVID, ng simple flu, trangkaso, simpleng sipon. Pero ang sinasabi ng WHO, dahil nga ito ay isang re-emerging infectious disease, there are several points that we can do, several strategies that we can do in order to manage monkeypox. One is fever and pain management, giving analgesics, giving paracetamol or some pain reliever, because, these lesions could be itchy or painful and patients will present with fever. Also, skin, eye, and mouth care, because of these several lesions, we need to make sure na hindi sila ma-contaminate or magkaroon ng cross-infection with bacteria. Respiratory care, patients who will be needing oxygen support. That's also recommended by WHO, especially those who would have complications like pneumonia. Like any other viral infection, hydration and nutritional support is very, very important. Um, Volume per volume replacement. If you are experiencing diarrhea or vomiting or having high fever, you're prone also to dehydration. So make sure that oral rehydration is being given. Mental health support. Again, this is something na kinakatakot ng lahat. So kung may isang pasyente na merong monkeypox, nandun din yung stigma. Katulad ng, at naramdaman natin or na-experience natin with COVID, nung mga unang kaso before. So mental health support is still very important as part of the management of monkeypox. Prevention and treatment of complication. Usual complication of monkeypox would be secondary bacterial infection, pneumonia, may similar to other viral infection, bleeding then. So these are the things that should be monitored and should be addressed appropriately if ever they arise. And also infection prevention and control in order to prevent community transmission or community outbreak or just transmitting this monkeypox to another person. So that's very important. And again, to date, there is no specific treatment approved for monkeypox virus infection yet, but WHO is considering some medication, some viral medications, but there is no FDA-approved medication yet for monkeypox. As to the vaccine, there is this Genius or the Invanix, which is a live virus vaccine for monkeypox and approved by US FDA. The Advisory Committee on Immunization Practices is currently evaluating the Genius for the protection of people at risk of occupational exposure, meaning healthcare workers. So they are now prioritizing healthcare workers for this vaccine against monkeypox. Well, from what we heard from DOH, they're trying to procure this also from the United States. In short, the vaccine for monkeypox is available but limited yung kanyang availability and access.
All right. So if ever again, it will be for those with occupational risk, no? So baka tayo yun. Wag na lang sana. So is there a link between COVID-19 and monkeypox?
Well, there's no specific link, but they're both viruses. And they both came from animals. And that's what we're thinking. They both came from animals. They're both zoonotic infection, but there's no close link, whether even genetics that would connect COVID-19 or SARS-CoV-2 to your monkeypox.
All right. So talking about genetics, will new variants develop as we have seen in COVID-19?
Well, as sa COVID-19, di ba, meron tayong alpha, beta, gamma, delta, and the last was Omicron. Do we see that also in monkeypox? We don't expect different variants from monkeypox because monkeypox is a DNA virus. It's an orthopox virus. SARS-CoV-2, the positive agent of COVID-19, is an RNA virus. It's a coronavirus. So between a DNA virus and an RNA virus, mas common na nag-mutate ang RNA kasi less yung stability niya and less yung threshold niya to mutate. So we don't see any alpha, beta, gamma in monkeypox.
All right. So like what Dr. Aaron Veloso is asking, no, in Europe kasi they've noted increased transmission in the MSM population, no. So do you think monkeypox is sexually transmitted?
Well, the cohort of MSM in Europe, particularly in Portugal, where they saw cases among MSM or gay men, that's what they thought then that it might be sexually transmitted. But actually, upon further research, they found out that it's not actually because of a seminal transmission, but it's because of the intimate contact, sexual contact, and sexual intimacy from by a person who has symptoms or who has monkeypox. That actually caused the transmission. And they also found out that it happened among MSM population in Europe because they actually were partying. they were in a club and one person has the symptoms already, and that actually caused an outbreak in that population. So it's not because of transmission of semen or vaginal fluids, but it's because of the act of having sex that actually cause a transmission.
So the incubation period is diba 5 to 21 days. So if you're uh, contact tracing, then you should also include your sexual partners the past 3 weeks. No?
Yes.
Yeah.
And
Okay.
do not engage in any sexual contact. If you see a blister or somewhere, or meron kang parang bulutong tubig. Or it could be bulutong tubig, it could be monkeypox, or who knows, baka syphilis pala.
Yeah. So kung may skin lesion ka, wag na muna.
Yes, oo.
Yeah.
Check muna natin. Check muna. Check.
Yeah.
Survey the scene. Survey the scene.
Yeah. So what steps have been put in place to prepare for and to respond to this outbreak, if we already have?
Well, the DOH published last week an interim guidance on monkeypox. That's one. All hospitals are on heightened alert already, and like what we're doing now, we're making everyone aware of what monkeypox is. There is this four-door strategy of the Department of Health to make sure that no cases or no community transmission will happen for monkeypox. And the four-door strategy includes the four doors: for door one, door two, door three, and door four. For door one, there is screening already from a point of origin of a traveler, especially outside the Philippines. For door two, the point of entry, our Bureau of Quarantine is also on alert in all our ports to make sure that no one will enter the Philippines, especially those with symptoms of monkeypox. The point of care is door three, meaning this is active surveillance, active case tracing, making sure that those who will present with these lesions will be reported and adequately managed and isolated. And also door four, preparing the healthcare system, that's capacity building for all hospitals, whether government or private. Now, the WHO, what WHO is doing is making sure that everyone, all member countries, are doing their part in the surveillance, the case investigation, and contract tracing. And because these three strategies will be our battle gear against monkeypox, to make sure that we will be able to break the chain of human-to-human transmission and hopefully not cause a big outbreak similar to COVID-19.
Okay, so what are the next steps to prevent future outbreaks and prepare the world against pandemic?
Hindi pa nga tayo nakaka-recover, no, or we're still in a state of pandemic for COVID-19, and yet meron na namang panibagong virus na nag-cause or who's giving us a threat of possible worldwide pandemic. So what can we do, or what should we do now? Again, surveillance and case detection. It needs to be strengthened around the world. And as infectious disease can easily spread from one country to another, especially with global travel present. Global cooperation is needed to share information fully and promptly, and to ensure the responses in low response countries can be bolstered. Again, and I'll echo what Dr. Enrique Tayag of the Department of Health told us. When someone asks you, what should we do for monkeypox? The answer would be, if you have fever, if you have rash, similar to monkeypox, it's best to report to your nearest epidemiology and surveillance unit, whether it's for city or provincial or regional epidemiology surveillance unit of your Department of Health, and go to the nearest hospital. Thank you. I think that's my last slide.
Okay, thank you very much. Saan daw yung monkey na yan? Mukhang sa beach trip mo na naman yan.
Nasa Subic, di ba? Nasa Subic, maraming monkey.
Yeah.
Actually, kapitbahay lang namin.
All right. Thank you very much, Dr. Pasayan, for the very informative lecture. We have many questions na on the floor. So let's start our Q&A. But some questions were already answered. Let's just give emphasis na lang on the answer. So, first question, could a genetic change in the virus explain the latest outbreaks?
Not necessarily. There was no actually changes seen yet. Like what I said, the monkeypox, the orthopox virus, is a DNA virus, so we don't usually see any genetic changes to happen soon. Still, there are two clades, the West Africa and the Central African clade, and so far in terms of phylogenetics, what we're seeing in other countries is coming from the West African clade.
All right. Should we get the vaccine for monkeypox?
If it's available, then and you are at risk, you are a healthcare worker taking care of patients, then it's advised that you receive such a vaccine.
Also, if you're a medical technologist who would get samples,
Yes,
process the
yeah, yeah.
specimens, they should also.
Nurses, doctors, medtechs, kasi mga medtechs po ang mag-scrape ng lesion.
All right. So, are there long-term consequences to monkeypox, and will the pox result to scarring?
Yes, that's the common side effect of the disease. Scarring, similar to chicken pox. I actually have the scar of my chicken pox when I was a kid. Other complications, like what I said, would be pneumonia, but these are the common acute complications of monkeypox.
All right. This is not related to monkeypox, but smallpox. Is smallpox vaccine still available, and can this be taken as post-exposure prophylaxis? Pero hindi pa yung post-exposure, wala na nga smallpox.
Yeah. It was removed by the US FDA, meaning yung approval nito was removed by the US FDA in the 1972. And it's still I think the United States CDC has it, but it's not being rolled out yet.
So, eto, how infectious is it? So may R not ba to? Worse than COVID? Is it
The R-
airborne?
yeah.
How is ang daming question ni Dr. Tobias. I'll read it na. Is it airborne? How does it spread? Would mask and distancing be required?
The R naught na reported is around 2. But again, very, very few kasi yung cases pa. Less than 500 actually globally. And pangilan-ilan lang. Wala pa talaga nakikitang extensive community transmission. And it's similar to any other viruses like varicella or measles. As to the transmission, sorry, I forgot the other question.
Airborne?
It's airborne. Yeah, it's droplet. It's still droplet transmission and contact transmission, getting in contact, close contact, or touching someone with a lesion, or within 1 meter distance from someone who has the disease. It's the same actually as your droplet precaution for pneumonia. But theoretically, according to the CDC, kasi nga similar siya with varicella, so there is a theoretical risk for airborne transmission, especially if you are taking care of a patient and there is airborne generating procedure that you are doing with a patient who has monkeypox. So what do we usually wear? Still, face mask is needed. Well, again, because of the theoretical risk, CDC is recommending N95 since airborne transmission is possible. And then gown. Any gown will do. Wag naman po tayo yung para sa COVID na talagang balot na balot. Any gown will do, especially if you're taking care of a person with monkeypox. Gloves and eye protection. Those are the things that we need to don if you're going to take care of a person with monkeypox.
Okay, thank you very much for that. So the next question is it the pneumonia that causes death among patients, or is it other complications?
It's usually pneumonia and sepsis based on the reports in Africa in the 1970s. But to date, dun sa mga cases seen in non-endemic countries around the world, there is no reported death yet.
Okay, this has been answered, but the question is, will the vaccines be available in the Philippines?
DOH is already doing its procurement for that vaccine according to one DOH official.
All right. And is the interim guideline of DOH for monkeypox sufficient given the long incubation period, specifically relating to screening of travelers?
Yes, that's sufficient. That's based from WHO.
So is there cross immunity with chickenpox or herpes zoster?
There's no cross immunity with chickenpox because it's a different virus. It's a herpes virus. But there's cross immunity between the orthopox viruses, which are monkeypox, cowpox, smallpox, and vaccinia.
All right. So is there any special safety precautions for collection and handling of monkeypox specimens compared to COVID-19 specimens?
It's still the same. PPE, same infection prevention and control, same biosafety protocol.
Yeah, so triple packaging system pa rin.
Yes.
So an anonymous attendee is asking, why only frontliners? Aren't we all at risk?
We are all at risk, definitely. But frontliners are the ones taking care of those sick people. So there is that double risk among frontliners. But of course, if there will be a community transmission, like what happened in COVID, then definitely everyone is at risk.
Yeah, so everyone's at risk, but there's kumbaga stratification, no?
Yeah.
No, just like for COVID vaccine. So what do we do in case we get it? Do we isolate, take precautions the way we do if we get COVID?
We cannot say na bakit ang chickenpox pareho lang naman pala sila ng sakit ay sa bahay lang, hindi naman usually nagpapa-hospital. Remember, monkeypox is a re-emerging infection. So anyone who would present such lesions or anyone who is suspected and confirmed should be isolated preferably in a hospital, and that's based on the DOH protocol. Because we want to make sure that there will be no community transmission or outbreak in the community because of monkeypox. So if you have the illness, if you have the lesions and you think you've been exposed and you want to make sure that you will not infect anyone in your family, it's best to go to the nearest hospital, and we will inform the Department of Health Epidemiology and Surveillance Unit regarding your case.
All right, we'll take this last question in the Q&A box. Similarities or differences with molluscum contagiosum, are monkeypox lesions painless?
If you look at the lesion, yung lesion ng vesicle, para siyang may tuldok sa gitna, para siyang, ang tawag natin doon is umbilicated or parang may pusod. And the same goes with molluscum contagiosum, ganun din, umbilicated. So similar, almost similar lesions, but then the only way to know whether this is monkeypox or molluscum contagiosum or chickenpox is to get tested.
All right, I'll just call Mr. Cesar Rios. Do you have any more questions, sir, or has the question been answered already? Dr. Rios? But I think he already asked a question in our Q&A box, so baka it has...
Hello.
Yes, good afternoon, sir.
Good afternoon. Yes, I just have a question. And what it's about the any precautions. Is there any special safety precaution for collection and handling of monkeypox specimens compared to COVID-19 specimens?
It's the same, Sir Rios. It's the same. Since both are very infectious viruses, the PPEs and the biosafety protocol that you observe in collecting specimen, whether for COVID or for monkeypox, are the same.
Thank you, Dr. Pasayan.
All right, we've answered all questions. Thank you again, Dr. Mark. This has been another fruitful webinar. So for everyone, just to summarize again, we have to know the symptoms so that we could identify who are those suspected to have monkeypox. And when we have suspects, just like in COVID, we isolate them immediately. We report to the survey epidemiology and surveillance unit of their respective LGUs. To diagnose is to do a PCR of the skin lesions. So our medtech should be able to know how to take care, to get the specimen and how to process, to transport them. And just like all other viral infections, it's really supportive care. But again, there's 10% mortality. It's really because of the complications. Of course, IPC is very important. So with that, thank you very much, Dr. Mark.
Thank you, Dr. Monica, for this Monica and Mark ID talk on QualiMed Health Network, and see you in our next episode.
Yeah, thank you.
Over to you, Charlene and Levy.
And that concludes our program today. Once again, thank you to Dr. Mark and Dr. Monica, the team behind this webinar, and our dear attendees for joining us today. Stay safe, keep healthy, and stay tuned for our upcoming webinar series about the importance of pneumo vaccination, prostate care, and aesthetics and surgery. To know more about the Health Matters webinar series, follow Healthway and QualiMed's Facebook pages or contact your account officers. Thank you and happy lunch.